to be known for what I did, but for who I am. I went into prison at 17 and a half years old, and I was released 31 years and 22 days later at age 49.
One time I was incarcerated. I spent a month in a cell, only leaving for a shower. It's not a place for any person, but I think specifically for young people, it can be incredibly damaging and traumatizing.
It is psychological torture.
The United States is a world leader in incarceration. There are about 2 million people who are behind bars in this country. Across the course of the entire year, there are millions of people who are cycling in and out of jails and prisons. As a doctor working in these places, you spend a lot of time standing in front of locked doors and gates, waiting for them to buzz you through. I get buzzed through. My patients, they do not. The ripple effects of how mass incarceration affects health across this country, particularly for minority communities and Black people who are overrepresented in terms of being incarcerated. Hey, how you doing, man? That is a huge public health challenge that I don't think the medical community talks about enough. So many people who are mentally ill in our society are falling through the cracks and are ending up in jails and prisons. These really are the front lines of mental health care. Every day I listen to my patients and hear them talk about the struggles in the community. They often are sleeping on the sidewalk, they do not have jobs, they do not have income, they cannot access clinics in the community because there are months-long waiting lists. But there are never waiting lists for prison. So the question is, how do we want to care for that person? Would we rather connect that person with treatment services, housing, supports, things that could potentially prevent people from making those same mistakes again? Or do we incarcerate those people and then often release them to the sidewalk with minimal supports?
I didn't imagine myself to be homeless, IV drug user, in jail every other month. I started high school as an honors and AP track student. I knew that I was smart, I knew that I was capable, but I just got distracted and really bored. I was diagnosed with bipolar, and I was kind of battling with that as well.
At 16, I had my own apartment in Palm Springs. I had my future mapped out until I decided to rob someone for their credit cards in order to pay for my lifestyle. When I went into juvenile hall, I was meeting people who were in there for murder. They put me in a dark holding cell. It was a hard concrete slab with a thin mattress. There was a steel toilet. Oftentimes, you're just having your face plastered on this door and hoping someone will walk by that you can talk to. I just remember being lonely and feeling helpless.
Incarceration takes away almost every coping skill that we have to improve our mental health. Hey, how are you doing? It's Dr. Morris. What's going on? It takes away our family, our friends, our access often to recreational activities, access to our existing treatment resources if they exist. So people who are incarcerated tend to have higher rates of mental disorders and substance use disorders, much higher rates than the general population. Once they're in these places, there are many added stresses that can then worsen those illnesses.
When I talk about my prison life, in 1992, they were opening up Calipatria State Prison, and I was selected to be one of the first buses there. There was overcrowding, the most inexpensive food possible, lack of medical services. The mentality is to make you feel less than human. And when we talk about mental health, they wouldn't even afford you a psychiatrist.
Sometimes patients become so desperate that they hurt themselves to get sent to the hospital. And then you have health professionals who have not interacted in these spaces, they haven't seen what it looks like, and will immediately say they're just doing it to get out of jail and discharge them back. Fortunately, in the United States right now, there's a large public discussion about mass incarceration and what we should be doing about it. There's a lot of attention towards diversion programs. Rather than keeping that person locked in a jail cell, are there options for diverting that person back into the community to get the treatment or services that they need?
Instead of being in jail, you are in the community seeking things to help improve the circumstance that led to the charge. Having a therapist, having a psychiatrist, learning about my bipolar and about medication, kind of letting go of my own internalized stigma allowed me to really, when I was ready, understand that I didn't have to necessarily live in a situation where my symptoms were taking control of my life.
We have to say, are these human beings worth saving? And I believe every human being is worth saving.
To put it bluntly, I could have died of an overdose. I could have spent years in prison. That really reflects the importance for that kind of client-centered care. Having someone who's there to help versus someone who's there to punish.
We release over 300 people a day from each prison. 300,000 a year is probably getting out. If we're not giving them the proper resources and treatment while they're in prison from day one, who are we releasing?
I got a job working with jail reentry services as a peer case manager, working with people who were in the exact same situation that I was.
Now that I'm out, I was commissioned to turn this space into a place of healing. I just imagine mothers visiting their children. The queen bee welcoming her little bumblebees in. 4.5 years out of prison, I have an LLC, a nonprofit. I work for an organization called RJoy, working on restorative justice for Oakland youth.
My hope is that we can continue to uplift each other and really heal some of the harm.
We can't design solutions until we understand the problem. It's so important listening to the voices of people who have been incarcerated. The people who are behind bars, who are locked in cells, who are put in handcuffs, people who are so affected by mass incarceration. I always come back to that central question. Why does criminal legal involvement continue to be the default pathway for people to access treatment? And should that be the default treatment, or should we try to care for people, provide for their mental health, their general medical health, before they end up in handcuffs and behind bars?